Hello, everyone. To NPP Meet the Author interview today with Dr. Francesco Bavato. He is a clinician scientist at the Psychiatric University Hospital in Zürich, Switzerland, at the lab of Professor Boris Kvetnov. And he's also a postdoctoral researcher at the Department of Clinical Medicine at the Center of Functionally Integrative Neuroscience in Aarhus, Denmark, in the lab of Dr. Mika Allen. And his research aims to develop novel pharmacological treatments for psychiatric conditions focusing on restorative sleep and brain plasticity. And today he's here because we're chatting about his recent paper published in Neuropsychopharmacology, which is titled Gamma-hydroxybutyrate to promote slow-wave sleep in major depressive disorder, a randomized crossover trial. And let's jump right into the first question we have for you today, Francesco. And that would be, in the study, you investigated GHB as a treatment for sleep disturbances in major depressive disorder. And can you first describe what GHB is, and then maybe follow up with what inspired you to explore this?
Sure. First of all, thanks for the kind invitation and for the opportunity to present my work. I feel very honored. So regarding GHB, it is actually a unique compound. It is an agonist of GABA-B and GHB binding sites, and it's actually an old drug. It was developed in the 60s as an anesthetic with the idea of having a novel compound to modulate the GABA neurotransmitter. It was then tested as a sleep medication, but later abandoned in favor of other sleep medications. GHB became popular again in the 80s and in the 90s for recreational use as a party drug. And in this setting, it's also called liquid ecstasy, NG. And it was rediscovered later as a medication and found to be highly effective as a sleep medication in narcolepsy. Narcolepsy is a neurological condition characterized by sleep disturbances, but also individuals feel really sleepy during the day and might suddenly fall asleep in unexpected ways. And here GHB was found to be really effective in increasing deep sleep, but also in reducing sleepiness during the day, which is a very special property of this substance. And we know in psychiatry that there is a strong link between sleep and depression. So on the one side, individuals with depression frequently have sleep disorders. On the other side, individuals with insomnia frequently develop a depressive episode in their life. So that's why we decided to test GHB as a novel sleep medication to help these patients. And we performed a clinical trial. So we recruited individuals with major depressive disorders, invited them in the sleep lab, tested their health status, and then performed a randomized, placebo-controlled double-blind design. So there was one night where we tested placebo, one night trazodone, which is one of the most commonly used sleep medications in depression, and one night with GHB. And in this study, we found that GHB was indeed very effective in increasing deep sleep, but also reduced sleepiness in the morning compared to trazodone, and was able to promote vigilance and wakefulness the day after. So participants were feeling less sleepy than trazodone, and that was consistent with our hypothesis.
You mentioned that GHB is a party drug. So how is it possible that it can be both a party drug with potential high addictive risk, as well as a sleep medication for narcolepsy?
Yeah, that's a very good point. This depends on the dose and the particular pharmacology of GHB. So in party settings, it's normally used at lower doses and repeatedly, while as a sleep medication, it's used at higher doses. And these doses have kind of opposite effects on the dopaminergic system, which is linked to addictive behavior. So at low dose, GHB reduces the activity of inhibitory interneurons in the ventral tegmental area, which is a dopaminergic area in the brain. And because of that, dopaminergic neurons are more active. There is more release of dopamine, and the behavioral effects are euphoria, prosexual effects, and this makes it popular for parties, but makes it also highly addictive. But at higher doses, what we use in our study, and is also used in narcolepsy, GHB reduces both the activity of interneurons and also of the dopaminergic neurons. It means there is a lower release of dopamine, and the behavioral effects are actually sedation and sleep promotion. And specifically in the context of narcolepsy, it was shown that GHB is safe, is not associated with high addictive risk, and it was actually found to have a lower addictive risk compared to other sleep medications, benzodiazepine, for example. But still, it's something that we need to monitor in future studies because we know vulnerable individuals might react in a different way. And before suggesting GHB for clinical use, we need to be very careful about this matter.
And there are currently several antidepressants also used as sleep aids, particularly in patients with MDD. Could you elaborate how GHB's mechanism of action differs from more traditional choices such as trazodone or mirtazapine, particularly in this context?
Yes, that's true. So there are already several sleep medications on the market, but they all have relevant limitations. So if we look at this sleep-promoting antidepressant like trazodone and mirtazapine that you mentioned, they can promote deep sleep. They make falling asleep easier. They can prolong the total time of sleep, but they also have long half-lives. So there are hangover effects, and individuals feel sleepy the day after frequently. And the same with hypnotics, like benzodiazepines that make falling asleep easier. They can prolong sleep, but actually have frequently a negative effect on deep sleep and also have long half-lives and hangover effects. Second generations antipsychotics are also frequently used off-label, but they also have long half-lives and they can induce these hangover effects. So this is a big problem, the use of these substances. And one advantage of GHB is it's a short half-life. So it's able to promote deep sleep in a very effective way during the night. But there is this paradox increase of vigilance the day after. And that's why it's used in narcolepsy. And that's also why we believe it's promising to potentially treat sleep disorders in other neuropsychiatric conditions.
How do you envision your findings influencing clinical practices for treating sleep disturbances in MDD?
Yeah, I think our study is really relevant because it's a first proof of concept study for GHB use in depression, but we are still at so we are still far away for clinical use. We only investigated a single administration. We had a relatively small sample size, only 23 individuals. So we surely need larger studies with repeated administration, also outside of a protected environment of a sleep lab. And in our study, we also focus mostly on objective sleep markers in EEG. But what we need in future studies is for sure to focus on clinical symptoms, on real-world symptoms, because these are going to be the target for the clinical application. So I believe we did an important start to research this substance, but there is still a lot of research that needs to be done before being able to provide a new treatment for individuals suffering from sleep disorders and depression.
Okay, thank you, Dr. Bavato, for taking the time to speak with us today. If you haven't already, please check out the article, which is linked in the video description below. As always, please feel free to comment or reach out to us on social media, which would be Blue Sky or X, if you have any questions.
Thank you.